Brand new study published January 6th in 2020 in the Journal of the American Medical Association Neurology, JAMA Neurology, by Anthony Contos and colleagues at the University of Pittsburgh. They examined the association from the time of injury to the first clinical assessment. So again, time from injury to presentation, and they looked at how that affected recovery time. So this was a retrospective study, meaning they looked back at cases that had come into their clinic, consecutive cases. It was a cross-sectional study looking at athletes, excuse me, concussed athletes between the ages of 12 and 22 years old. So kind of in that adolescent, young adult range. The sample initially included 416 individuals. However, 254 had to be excluded because they were either lost to follow-up, like they didn't come back for subsequent visits, or they had incomplete clinical data, which prevented them from doing a full analysis on this. Now, this happens all the time in concussion. Patients kind of come and go, and so sometimes you don't have a full data set, but they initially had 416 patients within the period of time they were looking at, and they had 254 patients that were excluded. So they ended up with a total sample of 162 people. They then split that group in relatively half based on when they came in. So if you came in from day 0 to day 7 after your injury, you were in the short group. If you came in at 8 days to 20 days, so after kind of the first week up till 3 weeks, they put you in kind of the late group. So we had the early group, 0 to 7. We had the late group, 8 to 20 days after the injury. And these are both relatively early presentations in the grand scheme of things. Now, how much would that make a difference, right? Coming in the first week versus coming in weeks 2 and 3. Turns out they looked at a number of different things. So the two groups did not have any differences in any other variables. So the number of females was equal between the two groups. The medical history between the two groups was the same. And the injury characteristics, meaning the symptom severity scores, the cognitive issues, the ocular motor or vestibular issues that patients were experiencing after the injury at initial assessment were the same between the two groups. So there's no other distinguishing characteristics between the two groups. You basically have two equal groups, the only difference being when they came into the clinic, either the first week or weeks 2 or 3. And can we guess? Can we guess what happened? Okay. The late group, so the group that came in after weeks 2 and 3, had almost 6 times greater likelihood of having a prolonged recovery than the group that came in the week earlier. Here's a quote from this study that was in the discussion section, which I thought you guys might like. In this study, athletes who were evaluated within a week of injury recovered in a mean of 20 days faster than those athletes seen 2 to 3 weeks post-injury. One reasonable explanation for this difference is the earlier initiation of active rehabilitation strategies, including exertion progression and opportunity to start structured physical therapies, example, vestibular, vision, and cervical symptoms. Further, without clinical guidance and behavioral management recommendations post-injury, athletes may have been engaging in counterproductive recovery strategies such as strict rest or excessive physical activity if you do too much. This explanation is supported by the fact that athletes recovered in a similar amount of time after that first evaluation. As such, the days before initial evaluation were primarily accounting for the longer recovery duration, rather than the time in which the patients were under clinical care with a treatment plan. So just to kind of reframe that in a different way, the difference between the two groups actually was just the days it took them to come in. Right? So once they initiated care, they actually recovered in the same amount of time from initiation of care to discharge. But the difference was simply in how long they took to come in. Where was I here? There is no reason to believe that group differences in clinical presentation, i.e. a group with a more severe injury or greater likelihood of vestibular dysfunction, accounted for the discrepancy in recovery time because the groups did not differ on any clinical outcomes, including symptom severity, neurocognitive test performance, and the presence of vestibular or ocular motor dysfunction at the first visit. In short, it appears that all athletes had similar impairments in recovery time after they had received initial clinical care, highlighting the importance of clinical care as soon as possible. Time to clinical care was a more robust factor associated with protracted recovery than many other constitutional risk factors and injury characteristics previously established as moderating factors of recovery. So the time from injury to clinical presentation is one of the best predictors of recovery. So you got to get in quickly.